I'm very excited to welcome Dr. Elliot Lander. Dr. Lander is a leader in the field of stem cell therapy, and you're also a urologist. So how did the two come together?
That's an interesting story. I've been on a little bit of a journey, but I started out, I studied biochemistry in college. I went on to UC Irvine where I studied urologic surgery, became a urologist, had a very big urologic surgery practice in Southern California. And then my business partner, Dr. Mark Berman, came back from Asia. He's a internationally known expert on fat transfer, and he shared with me this technology that people were using in Asia to get stem cells out of fat. Turns out, just dumb luck, there's tons, literally tons of stem cells right under your skin and your fat. And we didn't really appreciate that until about 15 years ago. We thought all the stem cells must be in your bone marrow, but there's maybe 100 times more in your fat than in your bone marrow. And the cosmetic surgeons in Asia were using a simple process of extracting those stem cells from the fat to use them to enhance their cosmetic outcomes.
Mm-hmm.
And he came back and we sat down and understood that this technology really could be used in a much bigger way than cosmetics. We can apply it to therapeutics because if there's large numbers of regenerative or repair cells in your fat and we can easily access them, which we do as a part of a surgical procedure, then we might be able to use that to help people. Because all of the problems we deal with are problems of cellular damage,
Right.
whether it's aging, disease, degeneration, damage, trauma, radiation, toxins, everything affects your cells and eventually causes cellular damage. And the only thing that can fix that or mitigate it is your own stem cells. And to the extent you can get enough stem cells and get them to the area, you can stay on the planet longer.
So is the only regenerative property from your own stem cells, or can you use other people's stem cells as well?
It turns out you can use other people's as well. And most of the stem cell industry now is focusing on other people's cells because it's easier to obtain other people's cells in many ways, especially if they get them from placental products and amniotic products. But it's a really nuanced area of science. Advocates for it will say it's absolutely fine because you don't have an allergic reaction to those cells.
Mm-hmm.
But the truth is there are other people's DNA in those cells. And when those cells get in your body, they eventually differentiate and grow into those person's cells. And you could have unknown or unmeasurable or unmeasured effects maybe later down the road if you get enough of those cells. So we don't know that it's totally okay to use other people's cells.
Mm-hmm.
But there's also some risks of disease transmission that we address most of them, but it's not 100%. So there's a controversy over whether your cells are better or others. But in a side-by-side comparison, most of the cells are pretty similar in terms of what they do.
So there's not a lot of women like myself going, oh, you want my fat for my stem cells here?
Everyone's saying that. People are very happy. When we tell them that all we have to do is remove a little bit of fat to get stem cells, they're like, take it all. They're very happy. But we actually don't want to do that because when we do the extraction, we take just a very small amount. You don't want to create a lot of trauma because stem cells home into damaged areas. And when we administer them, we don't want them to go to the harvest site. We don't want to divert them from their purpose. We want them to go where they're needed. So when my partner came back from Asia and we looked at this technology, it was really transformative because, I was very traditional urology practice, seeing patients, doing surgeries, and all of a sudden I realized that we had something here very powerful, but we wanted to study it in a rigorous way. We didn't want to just say, well, let's try this. So we got something called IRBs, which is like a bioethics committee controlled by the government, IRBs, Institutional Review Board. We put together protocols. We got doctors on board as specialists to help us with understanding the diseases and the deployments. And that process grew, and within a few years, we had hundreds of doctors all over the world in our little research network, using our protocols, using our technology, transferring information, cross-pollinating, teaching each other. And we really, in many ways, we really pioneered the field of the stem cell. You see stem cell clinics all over. Really, we're the ones that started that. And now there's a lot of different types of stem cells, like we talked about earlier. Some are from your own body, some are not. But regenerative medicine is a very, very rapidly growing field.
And how does it work? I mean, how do the stem cells actually regenerate?
This is a great question. The stem cells really can read a damage signal the way you might read Braille or hieroglyphics. With chemical signaling, sending proteins and genetic material back and forth between the repair cell and the damaged tissue. There's an exchange of communication. There's an exchange of information. And that information allows the stem cell to figure out what the problem is and then respond to it in a very specific way. So if you drop a brick on your toe, it'll know, the stem cells will go to that area. They'll know that they have to make a little cartilage and a little skin and a little muscle because they understand that injury and they read it and fix it. They're very smart. They're smarter than anything we can make in a lab. And it turns out that what we call progenitor, which means just natural state, unchanged in a lab, just plain old stem cells like you get from your body, especially in your fat, they're great at fixing things without changing the cells. So we kind of have two really parallel industries going on right now in the stem cell world. There's the traditional drug model, which is, stem cells are being studied in universities. They'll engineer the cells because you can't patent a primitive cell. You have to engineer it and change it. They'll patent it. They'll commercialize it, monetize it. It'll go through multi-center trials. It'll be put in bottles. It'll be, monetized basically. And that's a process that we've seen with every drug. But because stem cells are much more complicated than small molecules and the simple drugs we have now, it's a slow process. So as of today, there really are no options. There's no stem cell therapies coming out in bottles that you can use off the shelf. So while that process is happening, we're in a completely different but parallel scientific world where we're saying, okay, we understand that's a tremendous potential, that's a fantastic area of science and medicine, but what can we do for our patients today? Because we have patients, as clinicians, we're in the trenches. We're not in labs and we're not looking at microscopes. We have people in our offices who are pouring their hearts out to us with real conditions that they deal with on a daily basis, walking, functioning, thinking. And we said, what can we do? Well, if we have these cells and they're in their body and we can easily obtain these cells and not change them. In fact, we have scientific proof that they're completely unchanged by our removal process. They haven't been harmed or unchanged or modified in any way. And if we can just give them back to the person, then we've given them cell therapy without waiting 20 or 25 years and investing billions of dollars and going through a pharma model. So this is what we call personal cell therapy. And that's what we've been working on developing for the last 10 years.
So it's sort of like blood transfusions in the sense that when people have surgery or they have some problem, you can take blood, you can store it in a blood bank, and then if you need it, you can get the blood from the blood bank and then use it to help you when you're sick if you need blood. Exactly.
And that's a very good analogy because let's say you use your own blood. Sometimes people store their own blood before surgery. That's called an autologous biologic, which means it's from your body and it's not something made in a lab. It's a biologic process. And we do the same with your cells. And by the way, you can save your stem cells too and grow them and save them and ultimately be able to get them back later. But we're mostly focusing right now on what we call point of care, which means people come in, get a surgical procedure, a little bit of fat removed. The fat is separated so that the part that has the stem cells is put here, and the rest of the fat that we don't need anymore is put here. And this part with the stem cells is then given back to the patient in a clever way. Like, for example, let's say they have a rotator cuff injury in their shoulder. It might take 18 months to heal naturally because eventually it will, because your stem cells come out of your bone marrow and eventually go there, and a few get there. But when we inject millions all at once into a small area over a small period of time, what we call a deployment, a same-day deployment, we've created, maybe the military analogy would be a surge, because you're putting a very high number of healing cells into a damaged area.
Right.
And that accelerates natural healing. This is not magic, it's not a drug, it's the way we've been healing since people were on the planet. Forever. But we're doing it by harnessing that power of healing and concentrating it and targeting it. So when you harness and concentrate and target, you can amplify the effect. But we're not doing anything really so different. It's just really natural healing. And so it's very much in harmony with the way our bodies are supposed to work.
Right, so you're turning up the volume on what is normally would be a natural process.
Exactly. And because it's a natural process, that's why we're not really seeing side effects. People aren't getting tumors. This is just how we always heal. So, I've had people come up to me and say, well, I heard you're a stem cell doctor. I don't believe in stem cells. I'm like, well, how do you think you heal? On a daily basis, all of us, if we didn't have stem cells constantly doing their job, we would be dead within a few days. And stem cells, if there's nothing to do, they don't do anything. I call them the Maytag repairman. They sit around, they're just sitting there, but when they get a job to do, they're eminently qualified to do it, and they can change you and fix you.
I understand you're doing some work with the military now as well.
We have a number of projects that we have interest in. As I said, we work with a lot of physicians. Some of our physicians have a keen interest in traumatic brain injury and concussion. And actually, it's been something very dear to our hearts in our company. Some of our immediate team has been directly involved in this project. We have found out, and we've done this in animals and in humans, but we found out that if you have a concussion and you give cell therapy, your own stem cells from fat, it immediately reverses all of the symptoms of concussion.
Wow.
So right now for concussion, there's standard treatment. A kid gets a concussion on a football field. They tell them go sit in a dark room for a week
Right.
and don't do anything.
Sleep.
Don't do it. I don't know how you don't do anything. That's like
Right.
the act of trying not to do something is doing something. But in other words, we don't really have a great treatment. We're just sort of letting your own natural stem cells kick in and fix the brain injury. But that can be impacted. There's things we can do to intervene to accelerate that process. And we are doing some work. We're looking at doing something with the military now, and also there's a lot of people interested in this, professional sports teams and that sort of thing. But we've also used cell therapy for some patients with PTSD because there's a little bit of a crossover, especially with traumatic brain injury and PTSD. Sometimes they have some of the some similar symptoms.
Right.
And so we think that chronic traumatic encephalopathy can be mitigated. We can't prove it, but we have some indication that we can make an impact
Some
on
data.
that. We have some data. And we have collected all of our data, and we have the largest collection of data in the world for regenerative medicine because when we started in 2010, we decided we're not going to be those doctors who are like, oh, this works for this, and I know this. We're going to send patients forms and ask, how did you do? Did you have side effects? What's your pain score? What's your mobility? And every single treatment, every patient we've treated, every 3 months they get an email. They can answer it on their phone. And we've collected data now on 12,000 patients.
Wow.
And so we really are starting to understand what these cells can do, what they're good for, and maybe what they're not so good for, because they're not great for everything.
Right.
But it's important that we understand where to focus our energies and talents, because there are certain conditions that are very amenable to this and some not so much.
So if you have an injury that's old, let's say you had a concussion in the past, is this kind of procedure work on older injuries, or does it have to be something that's in the moment to fix it?
We have a few patients, I would call it anecdotal evidence, that we can make some clinical improvements in people who have injuries. I personally treated someone who had a motor vehicle accident with a brain injury 19 years ago, and they had a substantial improvement. So I can't draw conclusions yet. We just have some early evidence, but we're looking at that.
Yeah, that's interesting because, if you can help a young kid that has a concussion on the football field, that would change his life, right? Because you don't know, a lot of these people, they don't really see the effects of that injury until they're much older and they've started aging.
Right. I think people are starting to understand concussion a lot better now, and especially when we talk about military injuries, I think the impact on brain injury has been underestimated because people now with body armor and all the technology, people aren't getting maybe as much shrapnel injuries,
Right.
but they get these bomb blasts going off and it causes tremendous brain damage, but you can't see it.
Right.
So it doesn't get the attention of a guy who's maybe, or a woman who's has a bleeding arm or
Right,
a limb
right.
damaged from a bomb, but the brain has experienced tremendous trauma, and it can manifest in some very, very complex ways many years later even.
Right. I've seen some interesting PET scan studies, where they use contrast to see brain injuries where people have experienced a blast, and then you can see the damage on both sides of the brain from it moving back and forth in the head.
That's correct, Minda. As imaging technology has improved, we're starting to understand the nuances of chronic brain injury. So I think cell therapy has a role there, and of course the concept is like, why wouldn't it? If these are your healing cells, why wouldn't they help in some way? How could it not be advantageous? So there's a lot of reasons for us to keep putting effort and resources into studying this because it makes sense.
So this is sort of physician heal thyself, right?
It's patient heal thyself. We're using the patient's own body to heal themselves, which I think is very elegant in some ways.
And so does it work for people of all ages? Like if you're older, do you still have the benefits from your stem cells as when you're younger?
Yeah, the answer is yes, but we have to pay attention to certain things. In much older patients, for example, the stem cells that you might get from bone marrow, they're not as good, they're aged, and they don't grow as well. The ones that we get from your fat hold up pretty well over time. You can see that they sustain in terms of quality. So it depends on the type of stem cell, but stem cells work for everybody, and they work for young people. And one of the reasons young people, children in particular, heal so well is if you look at their stem cell counts in the first, 15 years of life, and both bone marrow and fat, they're tremendous. So we're just, we have this amazing, treasure trove of these cells.
And
but they're there all your life, too.
Right. And it's been very effective in cancer treatments also, stem cells, the use
They're
of
being
stem
used
cells.
in various ways. We were involved in a cancer project. Stem cells are naturally home to damaged tissue, so they can sometimes bring cancer-killing agents into damaged tissue, like cancer tissue. There's a lot of really amazing uses for them. This is like I hate to use the word embryonic because no one's using embryonic stem cells now,
Yeah.
but this is the embryonic time phase of a stem cell research. I don't want to make a plug, but there's a docu-series out there now that's Healthcare Revolution. It's about the documentary makers traveled all over the world and interviewed not just people doing what we're doing with personal cell therapy, but people in labs, people at universities, just everywhere. They were working on cutting-edge stem cell work, and they did a 10-hour documentary, and then you could get it online at healthcarerev.org. It's available. You could watch it for free, healthcarerev.org, and learn about what's really happening in this. I think it's the most exciting area of healthcare right now.
And is it something that insurance companies support or no?
Not yet. Insurance companies haven't completely recognized the value of this, and it's a whole discussion as to why, and we can go into it one day, but it's just, it hasn't penciled out yet, because even though it's cheaper than, for example, a joint replacement, for example, we just submitted a paper on 3,600 knees that we used our stem cells for. 82% of the patients got better, so they avoided or delayed surgery. So you'd say, well, wouldn't that be great for insurance companies, because they don't have to pay for all those surgeries. Those are very expensive surgeries, the titanium and the anesthesiologist and everything. But the problem is that if they approve it, then that'll, the gates will break down. Everyone's going to say, I want stem cells. Right now, they know that only a certain number of people will seek out joint replacement.
Right.
But if it's as simple as getting something injected in you, everyone's going to want it. So insurance companies are still looking at this to figure out, where do we get involved and at what level? But,
and also, if it's sort of the path to success, but the path to safety too, because if you open the gates, then maybe people who don't have the special twist that you apply and might not follow your protocols you have to be careful of who you go to for these treatments, because not everyone may follow your protocols. Is that correct?
Yeah, it's a little bit of the Wild West right now with stem cell. So, we were very rigorous in our protocols and proving, studying, evaluating, and we've had no deaths, no infections related to the stem cell. I mean, we've been really meticulous, but the laws of supply and demand. Doctors are seeing patients seeking this, going offshore for it. It's a cash business for the most part. We call it patient-funded research. There is no insurance companies paying for it, as we said. So a lot of people are like, well, I'm a stem cell doctor. I'll take my course,
it's like
my
plastic
online course.
Surgeons, right?
Right, and call myself an expert. And so there's a little bit of caveat emptor. You have to be careful, who you talk to. But is that way, I think, with a lot of new sciences, at some point, quality will separate out, and the people who are really, providing their patients with a good, safe service will continue to do so, and those who are not, I think, will fall out of the marketplace.
So I think what we've learned is that in terms of stem cells, it's a great opportunity for you being able to heal yourself. And that being the case, it may be worth investigating if you're injured or if you're suffering from some kind of brain injury or some kind of trauma and you need your body to be repaired. But also, it's up to you to be careful about the provider that you choose. Make sure they're qualified, make sure they're experienced, and make sure they're following the protocols of an institution such as yours. So remember, it's up to you to take care of your health.